45% on average of the hospitals in my district, of the 9 that I've gone through, say that not the hospitals tell me that 45% of the people that come through the emergency room are people who don't have insurance. And it's the most expensive health care we have. Why not invest in places that are like this? Why not do wellness programs that are in the bill? We have a huge problem with childhood obesity, smoking cessation, a number of things. We need to get people to be thinking about that and invest in young people. In this, if you go for kids, there will be dental and hearing and vision. If you lose your teeth, I'm told, at an early age, it takes 7 years off of your life. We hardly think about that, but when you think about it, that's 7 years of someone's life. So there's a number of reasons for us to do this. I just believe, at the end of the day, oh, by the way, for private or for independent people, there's an amendment that I put in the bill and passed. It got passed, believe it or not. It allows real estate agents or farmers or people who are independent contractors, real estate agents pay their own insurance, their own taxes and everything. It allows them to do what some of the farmers that came before our committee from Wisconsin talked about, and I thought, here's a pretty good idea. They could form a co-op. You could be the chair of the co-op, let's say, and you could get 30 or 40 real estate people or independent people or farmers, whoever. You elect the president of the co-op, much like an electric co-op, and you can negotiate in the exchange or whoever or your current place. And then when they did this, it drove their rates down 30% because they had 60-some farmers that went into the co-op and they were selling 67 policies instead of one, sort of like buying bulk. But it gives you an option. Again, this amendment doesn't say if you're a farmer or a real estate agent or an independent person you have to do anything. It just gives you strength in numbers if you want to be associated with a group of people that have the same problems you have. And I thought, well, if it worked in Wisconsin, let's see if we can't work it. It will also cross state lines because this is a national plan. So we fundamentally, I think this is mostly what this bill is about. Now, how are we going to pay for it is a big question that people ask. Well, part of it is going to be paid for by putting people on an insurance plan that they have to pay something for. Even 5% of nothing is nothing. 5% of something is something. So putting those folks in. Now, I should back up. I'm realistic enough to know that this is not going to be 100% coverage because not everybody's going to opt into the plan. I hope they do, but it's similar in Illinois where you have mandatory insurance liability for car insurance, and probably a couple people here have been hit with somebody that didn't have any insurance. They violated the law, but they don't have insurance. So we expect about 98% of the people in this country to be covered. 2% will probably say, I'm never going to get sick, or I'm not paying nothing, I don't want to do anything. Yeah, and for those folks, if they want to tempt fate, they're going to have to pay for it when they go to the hospital because there's no free lunch, because they have several options, and if they choose to exercise none of them, and they want to go to the hospital to be treated, they'll get treated, but they're going to pay for it, and we're not going to pay for it anymore out of our pocket for somebody that refuses to purchase it, even at 5%. There is language specifically written into this bill that prohibits non-U.S. citizens from being eligible for the bill. And I can quote the chapter for you and read the language for you. People have asked me about that. Do I think undocumented workers are still going to come into ERs seeking treatment? Yes, but the fact of the matter is the bill that we're passing is trying to address that by saying if you want in this bill, you have to be a citizen or a legal resident of the United States. Abortion was asked at a couple town meetings, and I thought I'd bring it up. There are no federal funds in the bill to pay for abortion. The Hyde Amendment supersedes all of that anyway, so there was no amendment in the bill because we already have existing federal law, and there was no need. It would be repetitive, and they probably would have ruled it out of order on the amendment because we already have it. So I think I've talked long enough and tried to go through it. Oh, one last thing for small businesses and business people. A lot of small businesses want to provide health care and are providing it. This bill gives tax credits for those businesses that do it, that provide health care. And the hope is that they will continue to provide the health care. The government's not going to go into the businesses and tell them you can no longer provide because we've got this exchange and we're going to do it. If the employer, but if the employer has the same option that a person has, they can go insurance shopping too, and I hope they will, if we can get it done. Because if that employer, and by the way, the auto industry will tell you they have more money in healthcare in an automobile than they have in steel in that vehicle. So what we want to try to do is give small businesses credit. Now, what happens to a business that says, I'm dropping everybody? I ain't covering anybody anymore, I'm tired of it. Well, okay, but that business, if they unilaterally drop people off, they're going to be charged, I think, 8% of the total gross salary that they pay, so that their employees have the option of being able to go out and it helps them purchase insurance. So that if you summarily decide you're not going to do it anymore, we want to try to make sure that they, at least that's fine, but understand that if you drop people who have coverage, this is if a company has coverage and drops it entirely for people, there's an 8% a penalty that they're going to pay. I call it a penalty, you can call it whatever, but that will help people who they've basically kicked off that thing. We think we can save a lot of money on the pay force by 30% of this easily by reducing the paperwork. A big chunk of this by getting people to start paying into the system. A big chunk of this will be paid for by people being healthier, by investing in places like this where people can come and get treated before their condition becomes to the point where it's going to be incredibly expensive. And for those people the bill, if it were passed today, would affect the surtax on individuals, wealthy individuals, would affect 99.5% of the people in my district would not have to pay an extra penny surtax for the bill. 0.5% of people would see an increase. So, I think it's a good bill. It's not a perfect bill, but I think that it's a bill that we put a lot of work into and a lot of effort. I know people are worried about this and about you can't trust the government, but let me just close by saying this to you. I share your worry about a lot of things, but if you're going to lose your home or you have somebody that's very sick and they can't get treatment, that's also very scary. I don't want the government, and I will promise you what I won't vote for. I won't vote for a bill that will where the government comes in and mandates your health care and your health care provider. This bill says you can go to any doctor, any hospital. There's no health care rationing involved in this bill. Nice drink. That's okay. That's mine. I like that. I get kind of steal it right from it. But in essence, what I want to see for everybody, and particularly for the two people who came today, is I don't want to see another person lose their home or have to pay $900 a month for insurance with such a high deductible.